talk about India. The country is doing mass cremations after what is being described as a tidal wave of COVID deaths. There are concerns that even the numbers we're hearing are underreported and that it could be even worse. What is the risk globally from the outbreak we're seeing in India right now?
You know, the Indian COVID crisis is a humanitarian disaster of epic proportions. It's dwarfed anything we've seen prior, and it hits records for COVID deaths, COVID cases, test positivity rates. They're seeing shortages of oxygen, of hospital beds. You know, this has global implications for first, just containment. We know that the virus does not respect national borders. So the fact that there is this second surge, unlike anything we've seen before in India, will have downstream implications for the world. It also impacts global reopening strategy, different countries figuring out when and how to open and whether this surge in India will impact them. And finally, it could have an impact on vaccine supply chain. You know, data has shown that about 10% of Indians are vaccinated right now. But in spite of the fact that India is one of the largest manufacturers of vaccines worldwide. So this is, of course, going to impact us in one way, shape, or form. And we really do need a coordinated global effort to help India at this time.
Dr. Nerurkar, it's always great to have you on. Thank you for all the medical advice and just the reminders for us that what's happening with COVID around the world, we need to pay attention. It's really important to us at home, here at home in the U.S. as well. Thank you.
Thanks, Allison. Always a pleasure to be here.